Zimbabwe has not been spared of the COVID-19 pandemic that has swept the globe. Risk of healthcare worker infection can be mitigated by adequate precautions within health facilities. Primarily, this involves the use of personal protective equipment, PPE. To support the ministry's preparedness and response actions, Cordaid Zimbabwe procured PPE using the Health Sector Development Support Project Additional Financing 5 grant to the government of Zimbabwe by the World Bank Global Financing Facility.
We have provided the government with PPEs for isolation facilities. So the PPEs which are procured are for infection prevention and control to be used by health workers. So the quantities were determined by Ministry of Health and Childcare, and we procured through UNDP, and these were distributed to the 5 facilities which were identified by Ministry of Health and Childcare.
So under the additional financing, we agreed with the World Bank to come up with a tracking system.
Before, we were tracking commodities, usually biased towards vaccines, medicines, and some of the sundries, the consumables we use. No one had yet said, let us distribute things to health workers. But this time around, the difference was we are now distributing commodities to the health worker. And we had to slightly customize our system to say, okay, we can allow for distribution of commodities to the one who's attending to the patients. So once that was done, we then had to train these health workers to say, okay, you are used to accounting for what you use on the patient, but now also account for what you use on yourself and your colleagues. A few facilities were selected to test out that idea. Then we are at a stage now where it has been proven that it works.
Tawa District Hospital is among the facilities that benefited from the PPE brought through the Health Sector Development Support Project to support the COVID-19 response.
In July 2021, we received PPE in response to the COVID-19 pandemic. PPE that the health workers that are supposed to use as they nurse the COVID patients to ensure that they do not contract any diseases as they nurse the patients.
What happens is when we receive the commodities from NATFOM, then there's the verification process that goes on, and the commodities, after verification, they are entered into the system, the EHR system, electronic health records that's being used to track these commodities. When they are entered into the system, we have got the barcodes that are entered into the system to allow ease of tracking of these commodities. So once the commodities are now in the system, they can now be ready for use by the other department. The department can either request the commodities or the pharmacy can push those commodities to the various departments. So all this will be done with the use of the system.
This tracking system, it had 2 strong components. Number 1, the management side, right? And number 2, the issues of us, being able to actually know that all the supplies have gone to intended, beneficiaries.
One of the main advantages of this system is that it ensures transparency. You can be able to track from where the commodity has begun to the last user.
Initially, what we'll do is we removed stock from the storeroom. We'll just remove from the storeroom, then issue, without indicating anywhere who we actually gave the PPE.
So with this system, we are now able to order what we require than to order blindly. One of the advantages of using this system is it allows us to monitor the utilization of commodities in real time.
So some of the major challenges we face, mostly they are technically based. So it's to do with the system itself. We'll be having network challenges at times because of the rains. We may be having power cuts and network normally drops. In those times, you'd not be able to work offline. Since this system uses like real time, you have to be online, the system has to be up.
Some of the gaps have been trying to transition the health worker who's used to writing on paper. Now they have to use an electronic system. So walking through that change, we are patient about it. We're also urgent about it. So the impact is going to be where you started with 5 facilities to test out a concept. You have a potential 1,000 facilities that can start using it. And all of a sudden, accountability for commodities expands exponentially, and we avoid those losses where leakages happen with that sort of visibility.